Discussion group, and we will start from the group 1 that had projects 1 and 3. And Andrew, floor is yours.
Okay, thank you. So it's just some short updates on project 1 and 3 from today. I think the first project on generic justification, if I had to pick one word to kind of summarize our discussion, I think it would probably be consensus, because there's a lot of agreement about what has to happen in that area and what the direction of travel is going forward. From yesterday and from our discussions today, I think the importance of test cases and collaboration perhaps on a test case is important. So that would probably be the main potential change for that project. But by and large, the discussions really were characterized by agreement on a lot of things that are already set out for that project. With regards to the third project then, the radionuclide roadmap, it's clear that more work is needed there, but again, it was also very clear that the attendees were in agreement about what needs to happen for that project. So focusing more on task-specific groups rather than them at a European, national and professional level. And as well, very importantly, working with the likes of the EANM, EFOMP and other agencies to identify who's addressing what and how best we can support each other to see full implementation of the Simple RAD recommendations. The importance of deduplicating work was also really important, and as well what came out from that discussion was the need for an additional probably stakeholder engagement exercise to identify what policy items are best addressed through the joint action from Simple RAD, and to identify who is best placed to address what. So is it the joint action addressing things like effluent release and leaving it to EANM and EFOMP to address other policy issues, or trying to identify what the most important ones are there. So I think the radionuclide roadmap, although the significant restructuring work needs to be done there, it will probably really still be by and large the same, again focused on Simple RAD, but we are in agreement about what needs to happen in order to see that progress towards the proposal. And I think that's the update from our group. I'll just ask Ava if there's anything else. Yeah. Perfect. Well, thank you all again for attending the group, and we'll have a panel discussion later if you have questions. Thank
you. Are there any questions about this project 1 and 3? If not, then we go to the next discussion group, group 2. There were Cara and Tricia. So, Tricia, please, floor is yours.
Yes, okay. I just need to close my eyes to think. So the first project in our group, that is, we're looking at EU JustCT as a validated methodology. There are several countries who are interested in the audit perspective. At the same time, and this is really for national benefit, so that we can begin to understand what the status is nationally, create new guidelines nationally, but we need to have something to measure our national levels too. So there are quite a few countries who are interested in redoing the EU JustCT. At the same time, there are other countries who see more value in doing, for example, outreach is a very fuzzy word. It's more than outreach. It's disseminating lessons learned, somehow making a change in risk perception, it's unclear, but we need to reach out, we need to inform, we need to create some kind of change. Behavior change is so challenging. It's fuzzy, but getting there. The second group Yes, this is very challenging because we're so interested in a way on occupational exposure. There seems to be such a gap. But optimization of the patient, as I understand it, is also about training. For example, if we have a health professional who comes and steps on a pedal and pushes a button and treats a patient, that care isn't necessarily optimized for that patient because it's the wrong health personnel who is using the equipment in perhaps not the optimal way. So there's this really strong focus and interest on occupational exposure, but we need to make a bridge to patient optimization justification, and we're missing that a little bit still. We need a heavier focus on the patient. But one very interesting thing that came out of this discussion was an uncertainty analysis. Can we use already existing data on both patients and providers to do an uncertainty analysis? We can easily do this with many different levels of uncertainty, using bootstrapping methods, using AI, using Monte Carlo simulation. So really focusing on currently available data through the OECD, through member states, looking at an uncertainty analysis, focusing on the patient, but also having side tasks that can have a focus on how high doses for patients impact high doses, cumulative doses for providers, not just interventional radiology, not just cardiology, but all of the different professions who may be impacted. But we're focusing, it's a challenge. The third project is, I think, something very exciting, and I think there was a lot of energy in the room. The actual proposal as it stands hasn't been touched. It stands as it is. We have a new idea that has a lot of support over 2 days, and that's really focusing on radiographers as health professionals. The possibility of having new phantoms purchased by the project. We have to define all of this purchasing and budgeting, et cetera, that are patient realistic, it's not the correct word, but focusing on training to get better image quality for the radiographers who are in fact the professionals who are using the X-ray machines. And so instead of looking at the quality of the image and mathematical modeling to determine whether the quality is good or bad, doing a great ground level intervention for improving the quality of the imaging by improving the training of the radiographers, because individual countries would never have 50,000, 100,000 euros to buy really expensive equipment that could then train from the base up. We're looking at a train the trainer approach, where we could really create a package that could then be rolled out across member states with the core team then doing train the trainer across member states. We don't have all the details, but it was so inspirational and so exciting, and is really now a standalone project, which I think we have also some commission support for. So we need to work out budget details, and but really inspirational. So thank you.
Thank you very much. Are there questions? Any questions on these projects? I could see that how exciting it was in this discussion group. That's great that new ideas comes out. Okay, if not any questions, then we will move to the discussion group 3. Yes, Dario and Ivana was leading that. Floor is yours.
Thank you. So I first will say it was really high-level discussion, and mostly we had high level of consent among attendees about the objectives of the project, and maybe some methodology or something new was added in the projects. For example, it was really discussed in the pediatric optimization project about how to include preterm infants in optimization and also how to include probability of skin injuries for pediatric patients in this project. The second thing is in pregnancy project, the main difference from the beginning is a decision to include also occupational, in fact, pregnant workers, and there was also some discussion of caregivers, though this is quite exceptional thing. And maybe it's worth to notice that a lot of our projects have some will have some deliverables that will be the guidelines. We discussed that the guideline should not be left just a paper after some current status or something, but we should have also a part of developing the guidelines should be also the testing the guidelines in some pilot hospitals, or this would really make this more important in terms of implementation of the guidelines. So this is more or less. Thank you for inclusion, for attending this discussion.
Thank you. Any questions on this? No? I will be very interested in when you have finalized and discussed further that what are the DRLs you have really selected to be included, but I think I will see that later. Okay, fourth group was Trude and Froje. So, floor is yours. Who is the start?
Okay, thank you. So today we had also very interesting, and I would say fruitful discussion on the project proposal optimization of the image-guided radiotherapy. We had 15 participants, 3 more than yesterday, from Norway, Estonia, Croatia, Czech Republic, Italy, Belgium, Hungary, European Commission, and Netherlands. There was regulators, clinicians, European Commission officer, radiation protection professionals. So the discussion was more like a jumping from the point to the point, giving the suggestions what should be included, excluded, what should be clarified. So what we find out is that we should first think to add the more information or information on local protocols on the IGRT through the survey, and also by using the results from the existing surveys. One good example is the Eurados survey, which was done under the work group 12. We're not quite sure how many technical details are mentioned or gathered through this survey, so we should plan to first see what are these data are. Then it was a very interesting suggestion that we should perform the gap analysis with respect to the patients, meaning what are the consequences so far on the patient treatment outcome when using IGRT. There was a remark from the oncologist that maybe this is not easy to do because it is not easy to clarify what is the influence of the autofill doses and the doses for the imaging, and maybe not enough time has passed from the IGRT treatment, because we are talking about second cancer risk for which you need a lot of years. So this objection was made basically come through the objection that we are more focused on the technical aspects. Also, interesting remark that we should consider whether that CT simulator should be also included as a part of the sources or the way of imaging for the IGRT, which stressed out that we should define the types of imaging and include all possible imaging modalities for the IGRT. Also, all types of radiotherapy should be included, not just the photon therapy, but the proton and the hadron therapy, for example, as well, which are more and more present now in the Europe. Of course, taking into account that for each of these therapy, the imaging is done using the photons, but could be some technical differences. And maybe two most important thing is that we should do the overview of what was done by at the EU level, by the ESTRO, and ICRP at the international level and other groups. And we should involve all relevant stakeholders at national and EU level, including the EFOMP, ESTRO, and maybe some others. Yeah.
Yes, and then for the topic of incident learning systems, we also had good discussion and input to the project, where it was noted, of course, that we need to take the output from Malin into account, and that the report from the Malin project will be finalized during this PRISMA project period. So these results must be taken into account. We had some discussion whether it was possible to develop some practical toolkits, like programs, etc., for doing reporting or but we didn't conclude, but that is something that we need to bring into the discussion in the further discussion when we develop these projects. Yes, there were a comment made that it was perhaps too ambitious to create full curricula for the education of the professional medical professions, but that we should change it to provide recommendation and input for the curricula. Yes. Let me see, I need to interpret her voice notes, but yes, that we this one.
Yeah, collection of the detailed case studies and toolkits, if available. Yeah.
Yes, that we will, during this project, collect input and get some studies or information from what has been done, that this is important, that it's creating these networks where information can be shared throughout the European countries, because there are some countries where incident learning systems is very well established on, in every field. In other countries, it's not so much in use. So it's important that we do create this network where people can both share information and about the best practices, and also get inspiration on how to take these ways of doing this into their own national practice. Yes, and it's also was pointed out that we need to take into account what already has been done and is already ongoing work in this field, and that we must take that into account into the project. And then we also had a project on the clinical audit, where there are many of the same issues, actually. And we see that also here it's very much difference from country to country, how this concept of doing clinical audit is implemented actually. Many countries there are legal requirement, but it's not being done, and in other it's very well established. So it was again pointed out that it's important to take into account the ongoing projects from Claudit and the one that we could not remember the name, but we will find out the one going on in Spain on clinical audits. To take those results into account. And we could also collect information about clinical audit through a survey to see what is going on in the different countries, that this is important, like a basis to see what the status is, and perhaps that we can see development through the project period, that it's increasing the amount of clinical audits done. It was also pointed out that resources is always challenging, and in the future there will be no solution on that, so that we need to find clever ways on doing this with less resources and in smart ways, so we use the resources most efficiently. And yes, then and here again, it was also pointed out that it's important to have these platform or networks for sharing information and best practices to be inspired to do and establish such system nationally. So, thank you. I guess there is much more, but we will.
Thank you very much. Are there any questions? If not, so there is. Good. Wait a minute.
I was just wondering, which are next steps? What do we expect to receive in terms of contact timeline and all this?
Thank you for the question. I was going to explain after the panel discussion what are the next steps, but I can do it now as well. So next week we start a process with these discussion group leaders to find out time slots. In these discussion groups, there has been a collection of email addresses, and those who participated in these discussion groups will be invited to online Teams meetings so that we can continue the work. And the aim is to develop more concrete actions, implementation actions, and maybe less guidelines for others, but really implementing. But we might need guidelines. I think it was a good idea from what Daria said, that if there are guidelines, they could be also tested, and so that is also implementation action. So the process will continue in a quite tight schedule, so that we will have the deadline, I think in August, in 3 months, to have the content prepared well, it was preliminary or something, the terminology. So it's not really the final, but still, I would say it's pretty final already to have the content there. So to get that aim, we need to work hard within 1 and 2 months. So that's why we need these meetings, and we will develop in Britain also these projects.
Can our online participants of today also participate in these following discussions?
Now, if there are online participants that would like to join these discussions, they need to send emails. So the contact point is our secretariat, and Charlotte Rosenbaum will take these notices from online participants that they would like to join. So it's possible. And also those who attended these discussion groups can share this with the colleagues, so that if in the organization there's somebody else who suits better to this project, please give this opportunity also for the colleagues. Anything else for the future steps at this point? No. Okay, then we will have a panel discussion. So I will ask now Charlotte and the discussion group leaders to come to sit here. Co-leaders as well. Yes. Okay. So we are going to have a discussion based on the discussions in the groups, and I have asked these group leaders to tell us 2 issues from each discussion groups that where they want to highlight in a way or another. So they have chosen some topics. It could be something that was very interesting in these discussion groups, or it was an open problem, or something totally different. And then the others in the panel, you can comment as well on that issue. Maybe you had also in your group similar issues, or otherwise you want to give a comment. So we will start from the discussion group 1. So you can, let's take one by one. So first the first topic, and then we can discuss, and then the second one.
Is it on? Yeah, it is on. Yeah, we have choose to concentrate on project 3, the roadmap. And as Andrew already has explained, there is a need to reconstruct the project. So to be able to do that reconstruction, there is, as he also said, a need for this stakeholder involvement. So we need to have further good involvement with the stakeholders to really identify ongoing and planned initiatives, and also to collaborate with other initiatives and how to maybe endorse their results and work, and also to divide who is doing what within the follow-up of the recommendations, so we are not duplicating. So I think that is one of the big issues, that we need to really have a new scoping of the project to make it feasible and best value.
I can understand this well, because the SIMPLAR report came out just recently, so it's very obvious that we couldn't be prepared that well to that. So actually that means that we need also time and resources to do this work, what Eva just described. Yes. Any other comments on this? For this topic, is there any other comment for this topic?
Yes, we have some other points. If it's, we also have, there is still some questions on how to participate, and I think some stakeholders that it's the European professional societies. They are very important stakeholders. EMA is a very important stakeholder. I don't know if it's feasible within this project or how to address it, but at least we need to have a close collaboration with them. And we need to sort out how to say, our way to work together with them within this project. And so there is a lot of questions that we need. And also the simple red recommendations have already addressed responsible parties, etc. So we need to have a good go through to how to take this further, I think.
Thank you. I think it's good to give the floor to our coordinator, still to address what are the actions that we can do about the participation. So please, Charlotte.
Yes, thank you. So this issue of how to participate, and we have discussed in the consortium, but now that we are getting more tangible cases, I think this really helps to see what organizations would like to participate, what type of organizations and what countries, because now we can do more, we have more concrete cases to act on. So we have an open discussion with European Commission and HDEA, and I think that both them and us can absolutely do our best to find solutions, because there are a lot more solutions than if you just read the paper and see the requirements. So I think this is a way forward, and it's very important that we now have met each other and see who would like to participate, and I think we can take it from there. We are on the right track there, and I have complete trust that we will find solutions in discussions with European Commission.
And sorry, Ritva, if I might come in there, I just want to acknowledge, Charlotte, you've done a lot of work working. Okay, thanks. Sorry, my colleague's just hitting me. Charlotte's done a lot of work to try and identify how people can participate over the last few months and work with HDEA to get clarity on that. And that's been very helpful. I think the presentation yesterday morning from HDEA presented some models of participation which do provide a lot of clarity and, you know, leave doors open for groups like the EANM and EFOMP to participate in this kind of work. I think there's still a small bit of work needed to be there to get that binary yes-no answer and to see how they can work with us. But specifically with that third project, there's likely simple RAD recommendations that are best led on from a policy point of view from the EANMs on their own front, or EFOMP on their own front, and then similarly there's ones that really need joint action for us to implement. But regardless of who's leading on it, we need to support each other, and we need the EANM and EFOMP support on our joint action and to work with us in order to get things over the line. So just to acknowledge again the work that's been done in that area to kind of provide clarity, but yeah, just that small bit extra work to see how we'll get that working in practice.
Yes, thank you, Andrew. Very important issues. Yes, I will give the floor to Tricia soon. You can pass the microphone there. So I understand that still, as Charlotte has said, that she will help in that if an organization, is it a university, hospital, some other organization would like to participate and is not sure if they are eligible, so Charlotte will help in that. So we have some test cases already in that, and European Commission HADEA has provided this help, so please email Charlotte and she will help you. Now Tricia, please.
Thank you. Just to comment on the stakeholder, so we did, as you know, do quite a bit of evidence synthesis and stakeholder interviews in the sustainability work package. We haven't quite, I've completed the analysis in my head, but I need to get it down on paper, I believe. But it's just to say there are some models, for example, with Pianoforte, of how different types of stakeholders could be involved at different levels and in different steps of EU for Health projects. I think what we need to remember that this is EU for Health, and the rules and regulations for receiving EU for Health funding as a competent authority or an affiliated entity are very strict. So we need to separate who can receive EU for Health funding based on clearly established links with legal authorities in the countries, and who cannot receive EU for Health funding because of these restrictions. If interested parties cannot receive EU for Health funding, there are certainly ways to contribute to the projects, and there are models for that, but it is very strict. So I think we have some work in the sustainability package, and I'm the task lead, so I take that responsibility to clarify the different ways that people can participate, and then harmonizing our effort with Charlotte's effort and Work Package 1 to then put a legal framework on that. So I think there's some work that we need to do to make those clarifications, and I just wanted to make it clear that I take responsibility for that work from Work Package 4, and just based on my experience with EU for Health, we need to separate almost in the way we do deterministic and stochastic effects, who can receive money and who cannot receive money, but it doesn't mean that you can't participate, if that makes sense.
Okay, thank you, Tricia. Now we were in these 2 points. Did discussion group 1 have still something you wanted to point out?
No, then it's additional points. So
yeah. Okay, we will move to the discussion group 2. So Carl and Tricia.
Yes, thank you. I think we had very fruitful discussions during the both days, and we have got a lot of valuable input. A general conclusion is that we need to focus on concrete objective and tasks that truly reach clinical practice and lead to real change. And if I should just mention one thing that came up in the group discussions, I would go to the optimization of radiation protection in interventional radiology. And to just raise one point is really hard, because there were many, many good and valuable inputs. But one of the things that came up was that equipment in interventional radiology is pretty much a black box and a closed systems nowadays. And it's hard to make changes in a closed system, which means that optimization is therefore more about optimizing procedures and also training of staff. So that's the point that I want to raise from our group discussions.
Thank you. And is there any comments on this? Okay, maybe Tricia is ready there to point out something else.
I'm going to talk about money again. What we're seeing is a clear trend of evidence synthesis. I'm looking at Hikwa, where are you? Evidence synthesis, data analysis, and these go across the projects, and there's a lot of tasks that require time, so person months, but it's not the people that are sitting in this room right now with MDs and PhDs and director roles and who ought to be doing those sorts of tasks. It's not the best use of funding, the best use of time. So in my experience with EU for Health, we have a capacity issue, not necessarily a funding issue, but a capacity issue, because we're using the wrong people to do the wrong tasks. So my question is, with Charlotte to the Commission, can we, as a joint action at the national levels, let's say Czech Republic, Estonia, Italy, let's just say, can we use the subcontractor? We never use subcontractors. I don't even know the word. It's not a. Can we use the subcontractor option at the national level to hire research assistants, project assistants, administrative assistants, to take these really important tasks, to work through the project? It's capacity building. Like if I was a master's student and said, hey, come and do some data analysis for this super exciting EU project, like, yes, pay me 15 euros an hour, absolutely, for 20 hours a week, like, dream come true. Instead of Ritva sitting down and mapping the synthesis. Ritva, sorry, it's not a good use of our time or resources and money. So it's transversal, so we need to find a way to use subcontracting budget to bring in research assistants, project assistants, administrative support at the national level to support all of you and all of us. And it needs to go into the budget beforehand. It can't be an afterthought. And it has to be integrated into the national policies or the institutional policies, so that when the project starts, we have the people in place, we have the funding in place, we can immediately start with evidence synthesis, the data analysis with OEC data, with Estonia registry data. It's all there, but somebody has to go through it. And it takes time, and then the seniors, I don't like a senior, but you understand, can start on the actions and the implementation, and everything runs in parallel and simultaneously. So, and there's also a budget question about, for example, if we need to purchase equipment, if we need to purchase rights to iGuide, if we need to purchase translation services to translate things into national languages, we have to have these conversations with the Commission, with Deborah and Work Package 1. So are these subcontractors 100% funded or 80% funded? If they're 80% funded, that means, again, nationally, we have to put in 20% funding. So there's so much around clarifying how we can use the money, how we can bring in employees for short term to do really important tasks. So this is what's come across all of these projects for me. Thank you.
Yes, thank you, Tricia. I think this is, again, a very, very important issue. So you have the issue of what organizations can participate and how, but this is more broad, like on conceptual level. What is possible in this way? I think this is another important part of discussion with the European Commission and understanding the legal frameworks. Part of it will be on a national level, because I think for subcontracting there are different rules between member states. But there's probably also like a general, there are general issues. And I think this point is really good to raise now also, because there's time to have this discussion, other than the limited time that you usually have between call opening and you have to submit proposal. So we have experienced that a year ago. That is a very short time, and I think that is one of the strengths of the construction with this preparatory joint action, that we can find out these issues, and there's more room to address them. So I think this is a very important part of the funding question, to get an answer. I'm confident that we can get an answer here. And then if we have any suggestions, then during this call process, we can also actively propose ways for organizations to use the funding, and how they can use subcontracting, or how they can attract trainees based on this funding. So thank you for this. Thank you.
Please. May I just, one tiny thing, another budget line that I thought of that goes in this same category that we never think of, graphic design. We never think about graphic design. I'm terrible. I make PowerPoints in Word and I'm terrible. We never think about graphic design. Printing, posters, these types of things, that's subcontracting because we don't have it in-house. So these types of things, we have to start thinking about how we can budget for it and make an impact across the whole project. And we have a comment here, please.
Just a short question about the scenario you have described, which could be the role of the national scientific societies. Should be included in the concept of subcontractors at the national level, or could have a different specific role? Yeah, this is just a short issue, but I ask you. Thank you.
So this question about where in the framework would professional societies, either national or European, be able to participate? Yes, I think this comes down to the same discussion on a little bit on two levels, on both national level and European level, to see how these organizations can participate, preferably with funding. And here it's very important to see the difference between national and European levels, because I know for professional societies there are quite some differences between member states in how these organizations fit into their national structure. Some have quite obvious ties to governmental organizations or to research networks, and some do not. And so there are many possibilities, and we just need to find out what are the general rules and criteria, and then see for the national level how one can fit into that.
There is...
I have a microphone. I'd like to ask about public-private partnership in this project. I think Trisha pointed out a good point on this capacity. That is essential. But then we have competence. If we do not have competence in our public organizations, like authority organizations, and we do not have that kind of competence, but we do know that there is competence in private firms, private sector. Can we kind of buy the competence, like subcontracting, if we need real-world data from registries, and if we need data analysis using AI? That competence, at least, we don't have in Finland yet in these public organizations. We are, of course, learning, but the private sector goes much, much further on that. If we need that kind of competence, is it possible to buy that in this project?
One of the possibilities within EU for Health program to participate is via subcontracting. So that's a regular option. The rules within a specific member states, that's something that you should look at per member state. I know that some member states just have a national rule or law or some obstacles that are difficult to overcome. But I know that in EU for Health, this is you can do subcontracting. You can also do in-kind contribution, of course, but that's you have to discuss with your partner if that's an option. But at least subcontracting is a standard option. Yeah.
Okay, Trisha, a short comment and then
Please, sorry, it's just about subcontracting, and just to say, in another EU for Health project just this year, at the Norwegian Directorate of Health, we're a public organization. I went right up to Hadea and we had a conversation, and they approved, because we didn't have subcontracting in our budget, so we switched it over. They approved the use of these funds, 60,000 euros, to have an external firm come in and help with AI and data analysis. Exactly. What happened? It went against our internal procedures for procurement. So even though the funding was approved, funding for subcontracting at the EU for Health level is rarely a problem, but our internal procurement, because it was over 100,000 euros, was above, so we had to go out with a anbud. Public. And that just took forever, and the project's over. So, yeah. So please keep that in mind. Thank you.
Yes, good example. But now we move to the discussion group 3, and Dario and Ivana.
I will tell something. In fact, our discussion in the first project about DRLs was how to choose which DRLs should be developed and implemented. And mostly we will do it according to reviewing the current status, but all of the projects will have something like this. Similarly, all of the projects will have some outreach. My question is even more, sometimes, for example, in, let's say, DRLs, we will, for clinical indications, we could use help from project that's dealing with justification, or sometimes projects are really connected. Is there foreseen some communication or coordination between different projects?
the plan is that there should be this communication, because there are clear links between projects and between other projects in Europe, but also within the joint action between projects.
So these joint actions will be just, in fact, under one umbrella or under one?
Yes, we are planning one joint action that have many kind of work packages and tasks in it.
Okay, so in fact, for example, this outreach or, because outreach usually should also have some social sciences included. We are not very skilled in this part, so it's something that will be dealt on, let's say, under this our group.
Yes, I think if I can comment on that we have now been talking mainly on the content. So we have seen project proposals. This is the content of this joint action. And whether it be 11 work packages or 4 work packages with projects that are closely linked, that we can determine. But beside those work packages, there will be like facilitating work packages. So one will be project management, who will do all kinds of organizational issues, financial issues, legal issues. And then a little bit like we have in Prisma now, but I think a bit bigger, we have, for example, communications work package. And they will have specialty in how to do news flashes or and then each project, when they have something they would like to communicate, they can go to that partner in the work package and say, I would like a visual prepared, I would like to share it over LinkedIn, can you please help me? And similar with like sustainability work package. If you have a specific question from your point of view in your content project, you can ask these facilitating work packages for their expertise to help you. And I think, I remember at the start of Prisma, we had a discussion how big should we go with, for example, web page and hosting web pages and more information online. And for us, because we are only 1.5 years and it was only 1 million, we decided to not go that far. And we decided we would have a steep learning curve ourselves. And for now that worked. But we already said with some of the, especially with colleagues from Work Package 2, with Donatas and with Gerve, that for the next one, this is absolutely necessary to have experienced people dedicated to that task so that the work packages on content can just tap into that. They can just call like a communications department. And so in that way, I think you can look at the structure of this project.
Okay.
Thank you. And maybe you had another point also. Is it Ivana?
Well, it was really hard for me to choose something which is really interesting or, yes, because there were so many interesting suggestions and discussions. And at the end, I chose to mention that during the discussions on projects in which data collection is envisaged, in case of this group, those were those 2 projects where data for development of DRLs, the data will be collected. So there was a suggestion and actually a discussion, not too long, quite short, but we were not sure that we came up with a conclusion. So this is something which probably should be further discussed. And the suggestion was to to make collected data publicly available, anonymized but available. So basically to provide raw data to everyone. So this is something I put.
Very interesting. So it would be established database with anonymous data that could be utilized by anyone. Very interesting. Okay. We will consider. Tricia.
And in our group, there was also a theme of open source, and so really creating that that value beyond the project, ensuring that we have open source data, open source publications, and disseminating in that way. And that was from Finland.
Yeah, and we also touched into this toolkits to develop and also provide toolkits. So it's linked to this open source thing.
Sounds good. And then we will move to the fourth discussion group. So, Trude.
Thank you. So, yeah, I have 2 points that I think it's important that we think about when we are going forward now, and that was emphasized during our discussion in group number 4 at different ways, and that is the importance to take into account already existing work have been done and also ongoing initiatives. And that could be on European level from the European professional societies or other EU projects. And this is very important that we do not duplicate. And I think it's more of to encourage the participants here and also online, if there are initiatives that you are aware of that touch upon these topics, that you bring this information to us, because we do not have the fully overview of all that is going on. So that is, I think, very important. Yeah, that was the first point. Do you want to have input on that before I go to the second?
Are there any comments?
Just to say that we also identify exactly the same need. It is important to identify ongoing and plan initiatives to do not duplicate and to work together. Very important.
Yes, it's going to be very important, crucial for developing this project further. Maybe you can take the next point.
Yes,
now.
Okay, then I have this next point, and that is, we talked previous about who can participate. So that is more of an administrative issue that, of course, must be settled, and we have clear knowledge on who can participate. Another challenge is how to involve, because I think very many, all of these projects, they require involvement from different types of stakeholders, from different levels, both from hospitals up to authorities, to also involvement of professional societies, different kind of stakeholders that are important to make this joint action successful, I think. And that is important that we have a good strategy for how we move forward now and are successful in promoting this important upcoming joint action and secure that we have the right stakeholders actually involved. So that was the second point.
A very important issue. What can I say? It's really crucial, as you said. Tricia, you wanted to comment?
So I think what needs to happen is that we need, and this is why member states at the highest authority nominate competent authorities. Because someone has to take the lead, the national lead, to build a national consortium. That has to happen. We can't take the responsibility for building national consortiums for 33 potential participants. So Eva and Trude and I are focused on the Norwegian National Consortium in parallel to the PRISMA work and in preparation for the joint action coming up, plus everything else. So Italy, who has 10 participants here, you really need to then work together as the 10 participants, in addition to the other Italian stakeholders, to prioritize how you want to be involved, how much budget you need. So it really now has to happen at a national level. Iceland, who has one representative here, Czech Republic, Estonia, we have 22 countries represented in the stakeholder workshop. So it's now a national initiative. And we certainly will reach out. We have the email addresses and we'll reach out. But there has to be a coordination at the national level moving forward, and that has to be your own responsibility, but we're here to support you. So we won't reach out to Sweden professional societies. Sorry, Carl, you gotta do that on your own, buddy. So that's the next step forward, I think, nationally.
Thank you. And I think one very big aim is in this future joint action that on national level authorities will start working more closely in a cooperation on this field. And there are ways for doing that, but I hope that this joint action will facilitate this cooperation. Anything else?
I'd like to raise one general issue. When visiting the groups, then of course most of the projects are taking recommendations from projects that have been running, are running under the SAMIRA action plan. And I think that the object, of course, is to bring that further. But sometimes I feel like if you take one step back, that may be very helpful. And what I mean by that is these recommendations of the projects that have run, you could take a moment before moving into the next action and the next recommendation, the next guideline, and just focusing on communicating more about these recommendations. So I know that each of these projects, the Marlin project, the EUJSCT, they've had workshops, and then they've had announcement of the publication. But why not take a little bit more effort in communicating about this? And then you can spring into action. I think that you could have more people on board who may not have heard about it the first time or the second time, which is okay. There's so much going on in this field, and everyone has also their own work, their own patients. So take that time for another communication round, and then you can jump into action, so to say. So that would be my view on it.
Thank you, Charlotte, because you are talking about implementation now and how to facilitate that. So it's also a very good point that so many good results are from other projects there, and the implementing and understanding the results is important before building up something new. We are soon closing the panel discussion. Are there any other issues you want to raise now? If not, I want to thank all panelists and thank you for your efforts also leading the discussion groups. And I hope that now we have a solid basis to continue. A lot of work has to be carried out. And now I give the floor to Charlotte.
Thank you so much. And yeah. So I would like to immediately pass on the microphone to our one of our representatives from European Commission, Georgi. Can you address our participant?
Thank you. Okay, I was asked to say a few words at the end. Okay, I'll bring you back a bit to the beginning, where my colleague Philippe Maxin spoke about why we have this joint action, and again remind you that this is part of this big SAMIRA action plan with in the field, then with the second work area of quality and safety, and it's taking place to fill a gap that we identified. So the SAMIRA action plan, we adopted in February 2021. So now we are more than 4 years later, and we have 15 separate actions, projects, etc. We have already published one Commission recommendation. We'll publish a second one soon. And there is a lot of evidence gathered. There is a lot of guidance created. And there is a lot of recommendations for further work that has come from this. There has been some efforts to also support implementation of some of this with, if we look at over time, what kind of actions we launched. We started more with studies, really data gathering, writing guidance, and moved more into action grants, supporting real action in certain specific areas. Sorry. And from the beginning, the SAMIRA quality and safety, the work in the quality and safety was conceived as these three elements: gathering evidence, creating guidance, and implementing, reaching the practice in the countries. And I think this is where we normally have the most difficulties. And so from what I saw today, the people have the general kind of instinct to want better data and more data, to have more guidance, etc. And I understand that. It's not a secret. I told it in the discussion groups where I was. I like most the actions where you're looking at what's there. So you take the step back, as Charlotte was saying, look at what's there and think really what we can do then to spread it in our country, to make a difference in the real practice. So I think there has been a lot of discussion around this and a lot of actually enriching the different projects in this direction, which is a very good step. I think there is also obvious need to involve even more actors. I think we see some gaps in terms of member states present here today. Some of them are online, and I really hope that they listen less carefully and they got more convinced if they had any doubts and questions that they have been cleared. We have some maybe still missing of the main stakeholders, like from radiotherapy. There was not much representation, and we don't have that much action actually. So this will have to be looked at. But I think it's all moving in the right direction, of course. So for the Commission, this is the biggest project that we are going to launch in this quality and safety area, this joint action. It's now clearing the steps. So as you know, the work program 2025 for the EU for Health, which actually sets the budget for the different actions, is not adopted yet, but it's really clearing now the last steps and should be adopted very soon. And then we'll be very quick in a discussion with Hadea what would be the time frames for launching the call. It's not an open call, it's not non-competitive call, as you know, but there is a call directly to the member states to appoint all these bodies, etc., and make a proposal. So there is a limited time for this. So I'm also very happy that we decided to do this preparatory action, give this 1.5 to 2 years to find out, how it all works, to structure, to build up the networks, etc. And I'd really want to tell to everyone that you should stay very, very engaged in the next few months in order to have a successful start of the joint action. From the Commission perspective, the SAMIRA action plan had a 4-year preset implementation period where we have to review it and decide what to do next. This slipped a bit. We will review the implementation of the full implementation of the SAMIRA action plan in the next year, 2026, where we'll draw our own conclusions, what needs to be taken to be done further. But I think in the quality and safety area, at least, we are on a very good ground with all these guidance documents, development, evidence gathering, and now the joint action moving more, as I said, in the implementation. Of course, in parallel to that, we have the well-established process of advising on the radiation protection framework under Euratom. We still don't have a timeline for this, but everyone is asking me always, when are you going to revise the BSS directive, etc. That will come, but it's not something that will happen next year. But we have all the framework there with the Article 31 group, with the Medical Working Party, etc. So this work will also continue. We'll have to see when we review the SAMIRA action plan, if we will continue the SGQS group, which has been providing so far a lot of the strategic guidance of what is missing in member states, what they need in terms of guidance, etc., and in action. And this informed the decision to take this joint action. But just to conclude before thanking everyone, I want to also repeat what something Ritva said before. This is and Philip, they are like completing messages. It will never get easier. It will never get cheaper, and that's your chance now to shape the future, not just in terms of requirement, but really do the things maybe that you wanted to do forever in your own country, but never had the resources, and always wondered how to start, how to do. So I think this is your chance. It's a multiple national projects with a level of coordination in between them, possibility to exchange, to use common these horizontal packages, etc., the support that will be provided, and the funding, of course. So I really hope that all countries that are eligible actually will be interested and will find a way to join this. So with this, it's my last chance to speak. I want to really thank everyone involved. I want to thank Charlotte and her team for organizing the project and this workshop, Ritva for all the very important conceptual and work, all the package leaders, our hosts. I don't see Ivana. Yeah, she's there in the back. And yeah, our technical staff too. Yeah, maybe a round of applause for everyone involved. Thank you.
Thank you very much, Georgi. Yes, I would also like to thank our Croatian colleagues for organizing this venue, this beautiful location. It's very lovely rooms, the right space for our purpose, lovely food, and also thank you for arranging the guided tour through the city of Zagreb so we could see this beautiful old city where we are today. Furthermore, I'd like to thank the organizing committee for this workshop. They have been involved in the program and all of the organizational issues. It has been a lot of work. Thank you so much for taking that up. And I'd like to thank our group leaders. A large part of this meeting has revolved around the breakout sessions. This was actually the most important part, and I think you've done a really good job at leading the discussions and bringing back the points that we can all take home. And there will be some work ahead in shaping the proposals further. Thank you for all your efforts to the group leaders. Thank you for representatives from European Commission for being here and actively participating in the discussion. I think this this is not only that you bring your ideas, but also that you are visible here and that you can share with the participants what your views are, where the Commission comes from. Finally, I'd like to thank everyone participating here, participating in the room, but also online. And I'm convinced we are on the right path here to move towards this future joint action. And in the remaining months of this PRISMA joint action, as Ritva said, we will continue online discussions about the projects and also further, once this call calendar comes out, then more concrete steps can be taken into discussing together what the future joint action will look like. And we will invite you and our participants online, of course, in this process. So thank you very much. And to conclude, I wish you all a pleasant and safe journey home. Thank you.